the student physical therapist for the day. Before we begin, do you mind confirming your full name and date of birth for me, please?
Hi, my name is Angelo, and I'm 63 years old.
Okay. All right, Angelo, what brings you to physical therapy today?
I've been having like this pain in my lower legs, kind of like not lower legs, kind of like all my legs, kind of like from my thighs all the way down to my calf.
Okay. And when did you notice this started happening?
It happened about 2 weeks ago. Yeah, I was walking. My doctor told me to start walking. He said it was good for me.
Mm-hmm.
But once I started walking, after a few minutes in, it just started hurting.
Mm-hmm. So how would you kind of describe that pain?
Kind of like cramping, kind of a little bit achy,
Mm-hmm.
and for sure burning.
Okay. Do you feel any numbness, tingling going down the legs as well, or is it more just the cramping?
I would say more than cramping.
Okay. No numbness, tingling, any like tingling down the legs or the calves?
Oh no.
Okay. Alrighty. And do you notice this only when you're walking, or have you found doing other things also brings it on?
When I'm grocery shopping,
Mm-hmm.
I have to go through the aisles and stuff like that. Or when I have to like go from long walks, like from
Mm-hmm.
one side of the building to another,
Mm-hmm.
I get that aching.
Does it come on pretty quickly?
It kind of gradually builds up.
Builds up.
Yeah,
Okay.
until like it's so much that I can't like take it anymore.
Right. What do you do typically to make that pain go away?
I just stop. Yeah, I find that just not doing anything or kind of like resting
Right.
helps a lot.
Okay. And when you do start resting, how long does it take for that pain to kind of go away?
About 5 minutes.
About 5 minutes? Okay.
A few minutes, yeah. I don't even count it, but if I had to guess, around 5 minutes or less, or
Okay.
even a couple minutes or less.
Okay. And have you had this before? Is this the first time this is happening?
2 weeks ago was the first time.
Mm-hmm. Okay. And does it happen pretty frequently?
Only when I walk for long distances.
Okay. All right. Is there any other important medical conditions that you have going on as well that we should know about?
Yeah, I have a few.
Okay.
I have diabetes.
Okay.
The latest 2, I think. Not the first one, the second one.
Mm-hmm.
I think my doctor told me I have hypertension. He also said I was kind of overweight. Yeah, he said I was obese. And then I also have something called PAD, I think he said.
Mm-hmm.
Like PAD or something like that.
Do you remember if it was like peripheral artery disease? Is that
Yes,
okay.
PAD. Mm-hmm.
Okay. And are these conditions being controlled by medications through your doctor?
Yeah, I take a lot of medications
Okay. Do you take them pretty consistently too?
every day.
Okay, good. All right, so in terms of anything else I have to ask you, just a few more questions that we have to ask everyone just to make sure you're at the right place today. So are you having any issues with bowel or bladder function?
No, I'm not.
No recent fevers or anything?
No.
Okay. Any pain at night that's keeping you up?
No.
Okay. General fatigue?
Not more than usual.
Okay. And any unexplained weight loss?
Oh man, I wish.
You wish?
Yeah.
Okay. All right, so I think those are all the questions I have for you. Is there anything else I missed that you didn't get to touch on?
No, not that I can think of.
All right, sounds good.
Hi everyone. So the epidemiology of vascular claudication is being of older age, smokers or having a past history of smoking, diabetes, hypertension, peripheral arterial disease, or being African American. As far as subjective, the patient may complain of aching, burning, or cramping pain in their leg/calf associated with walking and is relieved by rest. Typically, the symptoms will decrease within minutes with rest. The patient may also complain of weakness in the lower extremities when experiencing pain due to not enough blood going into the muscles.
All right, so we're just going to take a look at a few tests here. So the first one we're going to do is just measure some of your strength. So what I want you to do with this leg is just kind of bring it up here into my hand. Can you hold it there for me? All right, I'm going to push it down. Do you want me to push you down? All right, good. Go ahead and relax that leg. Can you bring that leg out into my hand right here? All right, bring it down just a little bit. And don't let me push you back. Good. I want you to kick that leg all the way back towards the table. Good. Hold it there. Don't let me pull you out. Good. I want you to bring that foot up to the sky. Hold it there for me. Don't let me push it down. All right. Same idea. I want you to push that foot down to the ground. Don't let me push it up. All right. And I would find that on both sides, strength is 5 out of 5. All right. And then I would check your sensation. So I would come around. Check on both sides. I'm going to swipe my hands on both sides of your legs. I want you to close your eyes. So you're just going to let me know if both sides feel about the same. Do these feel about the same?
Yep.
From here.
Yep.
Down here.
Mhm.
Both sides.
Mhm.
And on the back.
Yep.
All right. So I would find that sensation is also intact on both sides as well. All right. Now go ahead and check reflexes. So grab the reflex hammer. Go ahead and check that knee. Looks good. Go ahead and check this ankle here. Good. And I would find that both sides are also intact as well. An additional test we can look at is going ahead and analyzing his gait and also just doing a functional walking assessment to help bring on that pain. Right now he's been walking for about 2 minutes and is currently complaining of that calf pain down both legs.
Ah, that's my pain.
Okay, we would ask him to stop and go ahead and relax, perhaps sit down, and assess that that pain has gone away. How do you feel?
It's gone away.
I would also go ahead and take a look at his range of motion, which was also normal as well. Palpating down the spine and down the lower extremity would also be normal as well on both sides. We would just go ahead and test the ankle brachial index. If we find that he has a score below 0.9, we can go ahead and assume he has some vascular claudication being caused by his peripheral artery disease. This is still treatable by a physical therapist, but we can also go ahead and refer to the cardiologist for further testing.
For objective, the ankle brachial index will likely be less than 0.9, which can indicate PAD. You can also have the patient walk in the clinic, and when the symptoms occur, you can tell them to stop and rest. And after a few minutes of rest, the pain should decrease. And you can also see weakness of the lower extremity muscles when claudication occurs. And I would treat and refer to a cardiologist.